Good morning, everyone, or good evening, depending on where you are on the planet. It's an absolute pleasure to be here with you all tonight, or today, for the 6th day of the Virtual Island Summit. So welcome to you all, and thank you so much for joining us. I am your moderator for this evening. My name is Jessica Robbins. I am the Director of the Tasmanian Way, which is an initiative to facilitate a Tasmanian response to the UN 2030 Sustainable Development Goals. It is an initiative that builds on successful island models around the world, such as Hawaii Green Growth through the Global Island Partnership. Really wanted to thank James and Sarah and all of the Virtual Island Summit team for bringing us together tonight, as well as the speakers that will be joining us tonight. I am joining you from Lutruwita, Tasmania, the southern island of Australia. I pay respects to the traditional and original owners of this land, the Muwinina people, to those that have passed before us, and to acknowledge today's Tasmanian Aboriginal people, who are the custodians of this land that was never ceded. I pay my respects to the traditional custodians of the islands, waters, cultures, and other lands that join us here today. We do really want to hear from you throughout the evening, so you have two ways of doing this. One will be through the Pathable web browser, where you can start chatting and asking questions throughout the event. You can also use the chat function via Zoom. So to get started with this, it would be great if you could introduce yourself by telling us what is the traditional name of the land that you are from. We'll look forward to seeing who's with us and from the locations that you're in. So today's session, we're really going to focus on island responses to the COVID-19 pandemic. We're going to explore the impact and responses from 4 very unique places, from a collaboration on testing between the Faroe Islands and the Scottish Hebrides, to how Tasmania went from a COVID capital of Australia to COVID-free. We will discuss how the pandemic brought unique issues to islands, including its impact on the tourism sector particularly, and how Barbados is establishing efforts to boost this key industry. And just to say, wonderful to have people joining from Mull, from the Netherlands, and from Trinidad and Tobago to Johannesburg and Mauritius. Welcome to you all. So over the next 1.5 hours, we're going to hear from 4 wonderful speakers. We'll start with His Excellency Chad Blackman, who's Barbados's ambassador and permanent representative to the United Nations in Geneva. We'll then hear from the Honourable Angus MacNeil, Member of Parliament from h-Eileanan in Scotland. I hope I said that at least vaguely close.
You did.
Thank you. And then from the Honourable Kristina Háfoss, Member of the Faroese Parliament, a self-governing archipelago of Denmark. We'll then finally wrap up with the Honourable Ruth Forrest, Member of Legislative Council, Parliament of Tasmania, the island state from Australia. So I think you'll agree we have some fantastic speakers with us. Each speaker is going to provide a keynote address, and we will then have 20 minutes to answer questions or thereabout from you. So as I mentioned, please do feel free to really use this chat box, and you know, we really want to hear from you. I can still see, yep, we've got people joining from Baja, California to Martha's Vineyard, a really fantastic island in the US, and Guam. Excellent. So I would really like to take a moment to introduce our first speaker for the evening. As I mentioned, His Excellency Chad Blackman, who's Barbados's ambassador. Ambassador Blackman has worked in the international development sector for over 15 years and has engaged as an international trade law specialist and development consultant. He is the chair for the Trade and Environment Committee in the World Trade Organization and has served as a legal consultant in a Caribbean law firm where he led the team on issues around international trade and data protection laws. He was also educated at the University of Essex, not Sussex. So over to you, Ambassador Blackman.
Thank you very much, Jessica, for your introduction, and good morning, or good evening, or good night to all of you, wherever you are in the world. Firstly, let me say I'm very heartened on behalf of the government of Barbados to join such an important summit. And the name, the Virtual Island Summit, particularly in circumstances where the last couple months have shown us that the traditional modes of engagement, where normally we would engage on a face-to-face basis, or having to travel across the world to meet in circumstances where our carbon footprint would have been quite heavy. This has now served as a very good platform. But I want to preface my words this morning within the context of a simple phrase that we all have heard, I'm sure, that we should never waste a good crisis. And I really want to start with that basis. The last couple of months, for all of us in the world, whether we're large economies, small economies, landlocked, coastal states, doesn't matter. COVID-19 has really served as one, a leveler, and two, a reminder that we're all vulnerable in some way and that we all have peculiarities that we have to look at building out each other's capacities and strengths across the multilateral system. Now, Barbados's experience, prior to COVID-19 has been one where we've done well as a country, and we continue to do well as a country. A very small island nation state, 290,000 persons, roughly. An economy that's built on tourism, our number one income earner, followed by the international business sector. But we have our own unique vulnerabilities and challenges. Now, I want to put that context there so that you understand as I go forward in my presentation, you understand the context in which I speak. Given the reality, therefore, that tourism is our number one income earner and that our livelihoods as a country depend on that sector, you can well appreciate and imagine that COVID-19, therefore, has served as a major disruptor of our economy and the livelihoods of our citizens. Given that world travel virtually came to a halt, therefore it meant that hotels received no tourists. The taxi operators who would rely on the boom and the business of tourists coming to the country virtually ground to a halt. The food and beverage sector, which relied on the tourism sector, again, virtually came to a halt. And there was a high level of unemployment during that period because the income earning capacity came to a halt as a result of COVID. Equally, but to a lesser extent, we've done well in containing the news relative to COVID-19. Hitherto, we've just had about 170 cases, 5 deaths since the beginning of the pandemic. And I think that we've really done well. But because of those things and the vulnerabilities that come with that, it has really placed our interest in sharp focus and has caused the government to really look forward. How do we take this pandemic and all that has come with it to really move forward in a way to build back stronger? And you would have seen perhaps across the international media, led by our Prime Minister, we've used it as an opportunity. Tourism is still our number one sector, but Barbados offers a number of unique opportunities for persons across the world who want to continue working, but in a virtual format. So as a result of the pandemic, as a result of being able to see the mode of working remotely like we're doing here, we've now rolled out a 1-year welcome visa for anyone in the world who wants to work remotely with their job from Barbados. So you get the best of both worlds. You still get your income from your country abroad. You live in Barbados, you have beautiful beaches, you have excellent resources, excellent infrastructure, excellent technology. And we've now turned that challenge into an opportunity where persons can live there. But we've gone further. COVID-19 has also brought to the fore issues of vulnerability. And I think that's why this conference is even more important. Issues relative to how do small island nation states, who may be classified as either high income by the World Bank standards like Barbados is, or middle income countries, how do we leverage or access international finance? Because according to such a classification, you may be a high income country, which virtually means your GDP divided by its population, but you're penalized for your success. It therefore means because of that high income or middle income classification, you're precluded from accessing international concessional finance on that basis purely. Now, there are a number of other developing countries or other countries in the world who have large populations, large economic pockets, if I should use that term, but they're considered low-income countries. And in circumstances of natural disasters or external shocks like this one and COVID-19, they have the ability to, one, rely on their domestic finance, which is a large pool, and also access international concessional finance. So this issue we have continued to fight even before COVID-19, but it's really brought it into sharp focus now. That the international multilateral system has to now take stock at looking at vulnerabilities in a very sharp way, particularly for island states, small island developing states, whether you're in the Caribbean or you're in the Pacific. And I can tell you here in Geneva, the SIDS group, which I chair incidentally, we have actually led the charge in the multilateral system to say the time has now come that there needs to be a vulnerability index. And Prime Minister Motley of Barbados continues to lead that charge, where she said, and our government has said to the world, that the multilateral system has to take into consideration the vulnerabilities and peculiarities of small island nations. And it's also one of the reasons why we had put our interests on the table in hosting UNCTAD 15. Now, for those of you who may not be aware, UNCTAD, which is United Nations Conference on Trade and Development, serves within the entire United Nations system as the organization that has the mandate to treat the issues of trade and all issues of development. Not only trade from a development perspective, but issues of trade and development in its holistic sense. We will be hosting that in April of next year. And the theme of that conference is really quite timely, and it was actually agreed even before COVID-19 has taken place, which speaks to issues of vulnerability, from inequality and vulnerability to prosperity for all. So therefore, us hosting that next year in circumstances where the world has now gone through and is going through a global reset, that conference will help to reshape the global financial agenda, the global trade agenda, the global developmental agenda for all of us as countries in the world. Now, I truly believe, and I've said this in the WTO, we have to rebuild the world in a very strong way. Trade is necessary, but we have to ensure that it's balanced. So for example, you would have seen a higher than usual demand for PPE equipment, masks, etc., gloves. But how do we get our manufacturers in the private sector across the world to treat to these things whilst ensuring that the environment is not compromised? There was a report done that over the last 4 or 5 months, the landfills in our countries have been filled with these types of materials. So it's necessary for the pandemic, but how do we get our private sector to create and use opportunities like this to still produce these things, but in circumstances where it must be done in a better way, or materials that are not compromising the environment. We've also seen the reduction in travel. As I said, meetings like this are taking place. Diplomacy is still taking place like this. Private sectors are still meeting virtually, and we are getting things done. So the new normal has to be, how can we be more efficient, sustainable in ensuring that there's still growth and trade and development in a very sustainable way. So as I said, I started by saying that we must never waste a good crisis. What are the opportunities that we can leverage across the world? Because let's face it, external shocks will come. Not they may come, they will come. But how do we prepare for them? How do we look at sustainability and ensure that that sustainability agenda goes through our domestic policies and our parliaments and Congress? How do we give incentives to the private sector to use these external shocks ahead of time to rethink how we do things, still achieving the same objective of growth, profit, but being done in a sustainable way that does not harm the environment, that also allows for vulnerable economies to thrive and to trade within the global system. So I just will give those introductory remarks. I hand the floor over to Jessica.
Thank you very much, Ambassador Blackman. And no, I think it's a really great question to end on, is how do we reduce those impacts so that we can thrive. I would now like to introduce the Honourable Angus MacNeil, Member of Parliament from h-Eileanan. Mr MacNeil was born and brought up in the Isle of Barra on the Western Isles of Scotland. He's worked as a journalist with BBC, taught for 2 years in the Isle of Mull, and started the Gaelic medium unit before moving to Fort William. He lives on a croft in Barra and has 3 daughters, and has been elected as a Member of Parliament in 2005. So he served for 15 years in Parliament with the Scottish National Party as spokesperson on Transport, Foreign Affairs, Environment, Food and Rural Affairs. He's also the chair of the Energy and Climate Committee and chair of International Trade Committee. So over to you, Mr MacNeil, for your address.
Thank you very much indeed, and I find this absolutely a fantastic opportunity, and this technology has enabled us to island to island talking, because very often from islands we have to go to big centres, and to get back to islands again it takes an extra effort and an extra bit of work. But the technology at the moment that was there that we're now using during the pandemic has sort of changed an awful lot of things, and certainly for me it meant that I've been on this island for about 10 miles long by 6 miles wide for about 6 months, although next week I'm going to make my first foray away. And just a little bit more about the technology. I've been able to work at Westminster more efficiently from these islands than I've been able to work at Westminster itself, and actually vote faster by the technology, which of course, given the backward-looking nature of the Westminster government, they had to end quite quickly. So we're back to 19th century voting pretty quickly. Jessica in the beginning asked about the names of the islands, and I think they're quite interesting. I started to think as she was saying that, and I've tabulated about nearly 9 names. Inchical, which the islands of foreigners, is one name we have. In h-Eileanan, which is the constituency is known as islands to the west, so we're the west of somewhere else. We've been known as the Sudreyar by perhaps my DNA ancestors, and Suya Roger by the Faroese, Sudreyar by the Norsemen, who left most of the place names here. With the Outer Hebrides, with the Western Isles, in Gaelic again, Tiernas Ningeling, or the Lordship of the Isles, when we're linked to the Isle of Man. So we've had an awful lot of names, and the West and the South names obviously indicate that we're part of somebody else's world and not the centre of our own, which is maybe something that I'll touch on as I give the remarks about COVID. Indeed, like Chad was saying, tourism was and is quite an earner in our islands. It's not very well developed. We do sometimes call ourselves Barbados, and perhaps in homage to the good people of Barbados. And this working remotely from Barbados as the winter comes in did have a slight appeal, I've got to say. But we've seen the tourism impact. But some people actually quite like that. Those not directly involved in the tourism sector quite liked having the island to themselves, and almost a peace around. But our schools closed early on. They're open again now. Tentatively. Things like the churches were closed. They're open again now, but for limited numbers of people. Dentists and doctors have been difficult to access, certainly dentists. One of the reasons I got involved and more closely working with Kristina and Faroese colleagues was testing seemed to be quite a problem for us. Now, I'm quite aware of where the Faroe Islands are and what the Faroe Islands have done. Their testing, I think, is about the best in the world. They've tested, I don't take too much of Kristina's facts away, but they've tested an immense amount, and they've banished COVID twice. We've tested about 10% of population. We're very fortunate though. We've only had 10 cases in total of COVID-19 amongst our 25,000 population, and we've had no deaths. So we're the only constituency in the Westminster Parliament not to have suffered any deaths at all through COVID, which is very fortunate, and we're very grateful for that. Probably the sparseness of our population has contributed to that. We're the lowest numerical constituency at Westminster. However, we are an area that's probably the length of Wales. In the media in the UK, everything gets compared to Wales. So, somewhere in Africa or something in South America or in Asia will often be the size of Wales. Just coincidentally, to give you the fire in Australia has raged, that's about half the size of Wales, or something to do with the size of Wales. So anyway, I'm the length of Wales with a population of 25,000. We've tested about 10% of the people, and we've only had 10 cases of COVID-19. We've been very fortunate. This has led actually to another island problem for us, in that there's a perception now that we're a very safe place, and that there's a demand for housing has rocketed in our part of the world, which has led to young people banding together and saying there's going to be an economic clearance because they can't afford to stay in the islands here. So that brings with it this success on one hand can bring problems on another hand. Now, we don't really have a shortage of land here to build on, so quite why we've got the shortage of housing is something that needs to be tackled and addressed, because the land in many places isn't very agriculturally productive either. So there could be a lot more housing here, but getting access to the land and historic rights over land means that within the community to relinquish rights becomes a difficulty too. So COVID has certainly brought it's bringing change, and it's a driver of change. And I think many places are seeing that driver of change that COVID is, not least the fact that we're having this webinar on a Saturday morning. I'd been joking in the beginning, I think, with Ruth from Tasmania, that due to travel and everything else, my diary, firstly, our diaries emptied when COVID started, and then our diaries filled up again. But our diaries are filled up with stuff on Monday mornings and Saturday mornings, or Saturday evenings perhaps in Tasmania, with things and at times that are quite unusual. So things have been changing and things have become different over time. But I think one of the frustrations that I'll share with you, but being an island that's, as the names historically have shown, we've been peripheral too often to somewhere else, is that we can't control our own testing. So when there's an ease in the community about people coming backwards and forwards, as many people are working on oil rigs in the North Sea, working on merchant shipping to get tested coming back to the communities, we couldn't set our own policy for that. It was set in Edinburgh, and that was quite a lot of unease in the community. Although we have our own health board, we don't have the policy making agendas, and certainly that's why I looked quite enviously at the Faroe Islands. And then we had testing problems, and the Faroese had been way ahead with testing. So I'm very grateful to the Faroese for their open-heartedness and open arms and looking to help. Unfortunately, we weren't able to take that help because the help was dependent on somebody else in Edinburgh agreeing to us taking the help. And now this is my own political side, I've got to say. So you can see that even when the intentions are perhaps 2 steps back of the correct intentions, that sometimes if you aren't in control of your own lives on islands, it can have an effect. But as I say, fortunately, we've been lucky. We've only had the 10 cases. So we hope that it doesn't get any worse, but the response is not in our hands and our control, and that's an uneasy thing. But that just underlines so much else of some islands that we don't control enough in our islands, and it's controlled off us and things are done to us. And my final point I would just like to say generally about islands, and I'm pleased to see that people from many islands around the world, and I heard Martha's Vineyard mentioned there. When I look at the islands in this part of the world, from the Channel Islands, just north of Normandy, but crown dependencies of the Queen of the United Kingdom, around the Isle of Man, the Scilly Islands of England, the Hebrides, the Orkneys, the Shetlands, and the Faroe Islands. And then I compare those who are doing economically quite well. Those that are doing well, the Channel Islands, like Guernsey and Jersey, the Isle of Man, and the Faroe Islands, control on their own territories, have a lot of political control. The Hebrides, the Isles of Scilly, the Orkneys, and the Shetlands, which are probably second division islands, don't have that political control. And that itself is interesting, I would say, and something that's worth chewing over. But when you have political control and your own decision making, and you're not the periphery to somewhere else, but you're the center of your own world, that I think is hugely, or makes a huge difference to some of the outcomes you can expect for yourselves. So with that, I'll hand back to Tasmania and to Jessica Robbins. Thank you.
Excellent. Thank you so much, Mr. MacNeil. We really appreciate hearing from you. So before we move on, just a little quick note that there are some polls that are up beside the chat box. There's a little tab. So do feel free to go answer those polling questions. So at the moment, we see that 67% of participants are actually in a cluster outbreak or with community transition, which is certainly quite worrying and distressing. So I would now like to hear from the Honourable Kristina Háfoss, the Member of Faroese Parliament. Ms. Háfoss is an economist, lawyer, politician and mother of 4 with a career in IT, marketing and development within banking and insurance. She's served on numerous boards and has 2 master's degrees from Copenhagen University and is the former Minister of Finance and former Minister of Education, Research and Culture. So Ms. Háfoss.
Thank you for that introduction, and good morning, good day and good evening to all you who have joined us here today. And thank you for the opportunity to speak and participate in this event. It's a great pleasure, and it's of course an honor to be here with you today. First, I can explain a little bit about the Faroe Islands. The Faroe Islands are 18 islands in the middle of the North Atlantic Ocean. We are placed between Iceland, Norway, and Scotland. The Faroese nation is almost 53,000 people, and we have our own parliament, our own government, our own language, our own flag, to mention some of our characteristics. We also have a very strong welfare state and a strong health sector, and our main industries are fisheries and salmon farming, but tourism has also grown the last couple of years and is becoming more and more important. The Faroe Islands have become world leading when it comes to COVID-19 testing, and we have also been able to stop 2 major outbreaks of COVID-19. So I will try to explain some things about how this has been possible for us. Back in January, actually we started to prepare for this virus coming to the Faroe Islands when a researcher at our food and veterinary laboratory contacted our health authorities, and his advice was that we adapted the laboratory that we used to test viruses in our salmon and the salmon industry to test viruses in people. And our health authorities thought, yeah, let's do that. That's a good idea, and then we will be ready. And late February, our testing laboratory was ready. We didn't have any case back then. On 3rd of March, our first case came to the Faroe Islands, unfortunately. As the rest of the world, we were also hit very hard. But we right away chose a strategy of early intervention. We locked down in mid-March when we only had 3 cases in the Faroe Islands. And we chose a strategy of extensive testing and contact tracing all people who had been in contact with people who tested positive, and quarantine. And our lockdown also, of course, meant that we locked down our borders. And then we had very strict recommendations, of course, from the health authorities, but they were all based on recommendations and trust. We did not put laws into force to force people to stay at home. We said it has to be based on trust. And after 5 to 6 weeks, actually, we managed to be COVID-19 free. At that time, we were among the first nations in the world to get rid of the COVID-19 after a major outbreak. And that was also when I discussed with Angus MacNeil from the Hebrides, how could we exchange our experience? Could we also send maybe tests from the Hebrides to the Faroe Islands, and how could we help each other? Then we started, of course, a careful reopening of our society, and children went back to schools and people went back to work. And everything seemed to go well. So in mid-June, we started to open our borders. We knew it was a risk, but we chose to test all travelers who arrived in the Faroe Islands. And that actually has protected us for a long time. We were COVID-19 free for about 3-4 months. But in August, unfortunately, we had a new outbreak. And this outbreak was much more contagious. People were getting sick easily, but they didn't get as sick as we saw in March. And the reason this second outbreak came to the Faroe Islands was because one traveler that tested negative at the airport seemed to be positive after all. So what we did the second time was to go even more effectively and testing even more than we did back in March, and tested even so much that today we have tested about 107,000 tests performed, and that is more than 200% of our population equivalent to that. And that has been a major reason for us stopping this outbreak. Our capacity is very good because of this, using this test laboratory that we had for the salmon virus, for viruses in people. And I can mention that one day we actually tested 4,500 people. It's about 8 to 9% of our population just in one day, just to mention an example. If we look at the numbers, we have had quite many cases in these two outbreaks, a total of 416 positive cases. It's equivalent to more than 800 per 100,000 inhabitants. But unfortunately, no deaths, and almost all have recovered. At the moment, we have 6 active cases, but they are not domestic cases. They are people who have tested positive at the airport and have been put into quarantine. So it has been very important for us to protect these borders. We actually, yesterday, we had the first one thing we learned from the first, from the second outbreak has been that it's not enough to test travelers once. You have to test them twice, because even though they test negative when they arrive, they can be positive after a couple of days. And yesterday, actually, one traveler tested positive at the next test. So this is something we put into force after this second outbreak. And I think it's, we just hope that it will protect us from a third outbreak. If we look into what have been some positive things about the COVID-19, because of course it's a terrible situation for the world and also for the Faroe Islands, it has been that I think we see even more and stronger solidarity. People are helping each other, and I just hope that this sense of stronger solidarity and to support each other, and that we are in this together, also will reflect on the global politics. We also see that this use of IT, as Angus MacNeil also mentioned, schools and a lot of places have been very changing the way they work, and I think this is something we will also take with us afterwards as a good thing. In regards of our tourism industry, we were of course very hard hit also when we closed our borders, but the Faroese people have been very good at traveling in our own country, and that has also actually benefited with some good things. I think the people who have been hardest hit have been the people at our elderly home. We have been very protective of them, and that's also one of the main reasons that we have no deaths, because we have been very protective of our elderly people. Our economy has luckily not been that hard hit despite this lockdown, because of our export being food, salmon farming and also fisheries. I think it has made us less vulnerable because people need food all around the world. The prices have gone a little bit down, but we have not been that vulnerable. Our tourism industry is important, but has not reached those levels that you have in many other islands. So what we see now is that the unemployment rate is the same now as before the first lockdown, and we have almost no unemployment, only 1%. So we have been lucky in that way, and of course we put into force state aid packages and so on also when we went into lockdown, and that has also been a great help to us. I think if you ask what are the lessons learned from our approach, I must say that this early lockdown was very important during the first outbreak. The second outbreak, we didn't choose to lock down in the same way as other countries also have learned. We chose just to be more strict with some restrictions, not allow big gatherings and so on. But I think this extensive testing, contact tracing, quarantining has been vital for us to use as a tool. And secondly, to protect our borders has been extremely important, and will be even more now that we are COVID-19 free almost, to ensure that it doesn't come into the Faroe Islands again. And of course, it is vital that people follow the recommendations of the authorities, and there it's very important that you have very clear, and the communication has to be very good, and you have to have a trust between the people and the authorities. Here in the end, I could think that One other thing that we see this pandemic has done is like being a small island nation is not a disadvantage. On the contrary, being small is actually an advantage when you want to adapt fast. It is so much easier to turn a speedboat than a super tanker. So if you manage to think innovative and look at what kind of resources do you have in your nation, as we did, for example, with our laboratories, how can we adapt them to use as a tool to help us through this pandemic? And then it's actually a strength to be a small nation. But I think the very important thing is that you have the necessary independence and the necessary tools to take decisions. And that in that way, we have been very lucky in the Faroe Islands. We have had our own strategy, and we have had our own tools, a strong health sector. For example, if we were to send all our testing abroad, for example, to Denmark, it would take days before we got the results, and we would not be able to follow this very strict, extensive testing, tracing, and quarantine strategy, because people would have, we wouldn't be able to stop this process of people getting in contact with each other soon enough. So we need local solutions to stop this global crisis. And I totally agree with those who say that we should use this sad situation with this global crisis to build back a better and a fairer and a more sustainable society, both locally and globally.
Thank you so much, Kristina. There's some absolutely fantastic lessons there and points that are really relevant, I think, to numerous communities around the world. So our final panelist tonight is another very much a well-respected health professional. She's the Honourable Ruth Forrest, member of Legislative Council in the Parliament of Tasmania. Born and educated in the northwest of Tasmania, which is quite a remote area for us. She has worked as a registered nurse, a midwife, and is part of the Tasmanian branch of the Australian College of Midwives. She was elected in 2005 to the Tasmanian Legislative Council and is a graduate of the Tasmanian Leaders Program. And among many accolades, she was also named one of the Australian Financial Review's 100 Women of Influence. Ruth.
Thanks, Jessica. I've just got a few slides I'll share. You can go to the next one if you like, James. I just thought it'd be helpful for people to understand where Tasmania is, because a lot of people don't actually know. They think it's somewhere in Africa often. So Tasmania is a fairly small island, but in comparison to some islands we've been talking about, it's actually quite big. We've got a population of 524,000 or thereabouts. And we have about 1% of Australia's land mass, but we do get about 12% of the rainfall. The thing with Tasmania, I guess, is that we are a little bit different from the average Australian, which might sound odd, but we do have lower rates of education and higher rates of intergenerational poverty and disadvantage, which might seem strange when you've got an island state that thrives on agriculture and has really the cleanest air in the world on the northwest tip of Tasmania. And as Jessica said in the early introduction, we went from, in the northwest coast, we went from the COVID capital of Tasmania and Australia at the time to COVID-free. We have been for some months now. So we'll go to the next slide if you can, James. So just to give a bit of a summary of what happened, on the 2nd of March, we had the very first case of coronavirus. And then from the 5th to the 15th of March, we set up respiratory clinics, started implementing some social distancing rules and banned cruise ships from docking in Tasmania. 17th of March, we had a public health emergency that was declared. We have legislative powers to do that. And the first economic stimulus package was provided by the government. And in the 19th of March, a state of emergency was declared, and that meant that the Commissioner for Police basically took over control of the state and became the state controller, which meant you had one person who was in charge of the decisions. The government worked with the state controller, as did the Director of Public Health, but you had a pretty clear line of responsibility. So next slide, thanks James. So on the 20th of March, we were the first state or territory to announce mandatory quarantine for all non-essential arrivals. So anyone coming into the state had to go into hotel quarantine for 2 weeks. And the Ruby Princess cruise ship that docked in Sydney, the passengers were allowed to disembark from that ship through a bit of an error and weren't quarantined or assessed, even though many of them were showing signs of COVID. And we had patients admitted to the Northwest Hospital, Northwest Regional Hospital, and diagnosed with COVID-19. And then the second infected passenger was admitted on the 26th of March. And that was the start of what we consider a pretty major outbreak. The Northwest Coast has 2 small hospitals. One is a private hospital, one is the public hospital, and they are run separately. And we got a bit of criticism from the mainland Australia by using our moat. That was the headline on one of the local papers that indicated very clearly that we had a moat and weren't afraid to use it, and we effectively drew up the drawbridge. Next slide, please, James. And so then it became apparent that while most of the rest of the state was COVID-free or only had a very small number of cases, we were looking at down the barrel at an outbreak in a population that is is an older population than the rest of the state, and also has a population with a higher burden of chronic disease. The private hospital, which is basically co-located with the public hospital, was then taken over by the government so that we could access their beds, and all non-essential surgery was ceased. And then within a couple of days after that, both the Northwest Private and the Northwest Regional Hospital were closed. It was an unprecedented action. I actually had some direct intervention there with the Premier of the state and the Minister for Health and the State Health Controller at the time, because I had worked in these units and I knew how it would spread in the way the hospital was designed and operated. So those patients that were there were transferred to the nearest other hospitals, as many as could be sent home and isolated at home could be. And then approximately 5,000 Northwest Tasmanians were put into quarantine at home. This was health professionals and their families. And then we had the Australian Medical Assistance Team, or AUSMAT, which is a federally funded and operated team. They came from the mainland to help with a deep clean of the hospital, and their health workers then reopened in a staged approach the rest of the hospital. We already had some fairly strong lockdown provisions in place, but the Northwest Coast had additional impositions put on, I guess, which created an interesting situation where the state became quite divided. If we go to the next slide, please, James. So this might seem like a bit of a joke in many respects, but I can assure you it wasn't at the time. In Tasmania, we're quite parochial, and the north of the state has a beer called James Bogues, and the south has a beer called Cascade. Corona beer is not made, as you would know, in Tasmania, and this was circulating on social media. And whilst it was quite amusing, it was also the way we were seen as the pariah of the state. And there was all these calls to have a really hard lockdown of the region so that none of the Northwest Coast people could leave the area. There was almost a bit of vigilantism went on during that period, which was a little bit unfortunate. Healthcare workers were being harassed and being abused in shops when they were out shopping, at petrol stations. There was some pretty unpleasant behaviour, and listening to people speaking about Northwest Coast residents and in the media and on social media, it was pretty unfortunate, and it was a pretty stressful time. And as a healthcare worker myself, I was very aware of the risks and became very involved with the Premier, helping him to understand what was going on in the community. You can end the slideshow if you like, James, and just go back to the main screen. So we ended up having a total in Tasmania of 230 cases, which is not a lot in the big scheme of things, but at the time in Australia, it was a really significant outbreak, particularly in a vulnerable and aged population. We had 13 deaths in the whole state, but 12 of those were in the northwest. And thankfully, we only had one in an aged care facility. That I think when the first person was diagnosed in the aged care facility, it was, they were locked down really quickly. The whole staff and residents in 3 aged care facilities where one worker had been working across were tested. And thankfully we only had one resident that was positive, but unfortunately she did die. So I think the messages and the things that really worked in getting it under control was that's early and decisive action, as others have talked about. There was the importance of really consistent and clear messaging. The challenge that I had with my community was that there are low levels of education. There's very low health literacy rates in my area, and a lot of people struggle to find things on the internet and on websites. So a lot of my time was taken by trying to put things into simple language, using diagrams, putting out regular posts on my social media, which a lot of my constituents told me was more helpful than going to the government site, which had so much information and it was really difficult to find. So it became really such a busy time. You sort of look back now and think, did that really happen? It was just overwhelming. But we did have a really united approach from all parties in government. I'm an independent member and not always have seen eye to eye with our Conservative government. And it was really refreshing to see the cooperation that happened between all members of Parliament, and I think that was really important. And the use of a whole variety of communication channels and actually tailoring the message specifically for each region was important. So I think they were the key learnings. And what made it work was that cooperation and consistency of message. Thanks, Jess.
Excellent. Thank you so much, Ruth. So we're now going to move into our panel discussion. We don't have a huge amount of time left. However, we will try to get a few of your questions answered. So I'd like to start with a question for Ambassador Blackman, which is, how do we ensure such financial mechanisms do not increase the external dependency of SIDS as well as their debt?
Thank you very much, Jessica. And I'm heartened that you asked that question because it goes back to what I was indicating before. Small island developing states and other groups in other countries as well, but peculiarly those of SIDS, continue to face this issue. In UNCTAD, I can tell you, the organization has for a very long time trying to bring the awareness of the international community that the vulnerability that small island states and other developing countries face relative to the debt issue is very critical. Now, you can appreciate, for example, during times of major external shocks, whether that be issues of climate change in terms of hurricanes, cyclones, and other forms of natural disasters. Countries who are already highly indebted in circumstances of those natural disasters then have to then go to the international market and incur more debt to be able to retool and restock their economy and to get the economy going again. And therefore, it becomes a very vicious cycle on top of the debt burden that you already are carrying. So one of the things, for example, that Barbados has done, and I think this is a model that other countries ought to follow, is that, for example, in international contracts, also for major loans, one of the things that we're looking to do is to have built in to our contracts with external partners, other countries or financial institutions, is a clause which allows for, in circumstances where there are natural disasters or major external shocks, that countries like Barbados and other SIDS are given the opportunity not to have to incur further debt, as it were. But it has to be fought also on a different level. The multilateral system, the multilateral financial system, the multilateral trading system has to now come to understanding that the vulnerabilities of small island states, peculiarly so, place them at a higher disadvantage. And therefore, we now have to ensure that that carve out, that niche for policy space has to be there. And that's why it has to be done on a matrix and a criteria that's so critical. And the vulnerability index that I would have mentioned to you before serves therefore as a foundation for there to be a very clear way to measure countries' capacities to carry these things as we go forward. So I think that's the way forward in that regard.
Excellent. Thank you so much, Ambassador. And I have a question for Kristina. It's from Francesco Sindico, who is asking, does the government have accommodation in place for people who test positive upon arrival? And secondly, can you say something about whether your university has strong testing provisions for foreign overseas students who may join later in the year?
Thank you for this question. Yes, we have actually from the beginning we have had a hotel, a kind of a quarantine COVID-19 hotel available for people who, both for Faroese people who have not been able to stay at home, maybe because they have a partner or children who have some disease that they shouldn't be close to them. Then we have had the opportunity to go to this special hotel that we have set aside to quarantine people. And if people come here, foreign people, they maybe have rented a summer house or a house through Airbnb or something. Then they will stay at that place, which they already have rented in quarantine. But of course, if they do not have any place to stay, then they will get a place at a hotel. So, and the other question was regarding the students at the University of the Faroe Islands. All travelers who come to the Faroe Islands are tested when they arrive at the airport or at the port, if they come by ship. And after 6 days, they are tested once again. So after that, if you test negative twice, then you can say free to go studying and whatever you would like. And on top of that, you can always go and get tested. There is no limit. We have these testing facilities around on several of our islands, so people can just go there, get tested if they just want to feel more safe or if they feel sick. So all people, also foreigners, are welcome to go and get tested, and that's actually we try to tell people to go get tested as much as possible, just to be sure, and especially people who work in our elderly care homes, people who are teachers in our schools, and people who work with children. They are actually tested quite often, just to be sure that if there should be just one person with this virus, we could stop it immediately. So that has been one reason why we have stopped this outbreak very effectively.
Can I also jump in there, Jessica? I mean, there's great credit to be given to the Faroese in this area. And they're almost a global example, I think. I mean, they've tested 200% of their population. They've banished COVID not once, but just about twice, I think, Kristina. I think you've had no positive tests again from your second outbreak in 3 weeks. I think the question I would love to know is, some people say, oh, we can't do that in our country because of the cost of it, but you're bearing the cost of testing 200% of the population. Is there any idea how much that actually cost you at this stage? Has that become public knowledge yet?
Yes, of course, we have numbers for that, and we're following it also in Parliament, asking how much it has cost now. There has also been a discussion on that foreigners who come to the Faroe Islands, they should maybe pay for their own test. It wouldn't be unfair, but actually so far we have chose to make it free. But now the government has said that in October, foreigners will pay for that test. I think that's okay.
So being a Scottish foreigner, I'll get up there before October.
Yes, you have. Thank you, Angus. Yes, I believe that it is quite unique that we have such a huge testing capacity, and it has been possible because of what I mentioned, that we've been like innovative by using the laboratory facilities that we have in the islands. And I guess that if other island communities also look closer to what kind of facilities do we have, and can we adapt them into testing viruses in people instead of testing viruses in, for example, in our case, salmon, then they suddenly would have a lot more capacity than just putting all through the same channels and the same laboratories connected to the hospitals. So,
interesting.
Excellent. Thank you.
Around the cost of things, like the cost of testing and that sort of thing, in Tasmania, we provided hotel accommodation for everyone coming into the state while our borders were closed until about a month ago, when the government made the decision that anyone coming in now, unless they could be granted an exemption for financial hardship or because they've been on the mainland of Australia having medical treatment, they had to fund their own accommodation. Well, they had to stay in hotel accommodation the government approved, but they had to pay for it. So it's interesting.
Excellent. Thank you very much, Ruth. And actually, I have a question from one of the audience members for you, Ruth, which is from Maggie Shetty. So, does low COVID figures in the islands relate to a more outdoor life?
Well, I think certainly in Tasmania's case, it was much easier to keep people apart. The outbreak that happened is still ongoing in Victoria. You've got millions of people living very close together. You've got a lot of people living in high-rise accommodation and many people in one apartment. In Tasmania, we have low-density housing pretty much right through the state. So I absolutely agree, it's easier to socially isolate but not be felt like you're closed in really confined spaces, because it must be very challenging for people. But you still need, I was still particularly aware of the need to socially connect with people, even though they might have had a decent sized house to isolate in. That emotional separation and that psychological stress that came from being locked down, even though you could still walk around your yard, was quite significant. And the implications for all of our citizens' mental health has been an issue that's been of great concern.
Maybe I could add.
Mm-hmm.
Yeah, I could add regarding this outdoor life. That has been actually a positive thing about COVID-19 and the lockdown, because the recommendations of our authorities were to people, you don't go together with other people, but you have to go out every day, go out and get fresh air and go for a walk in the mountains and so on. So we saw like people all over enjoying the nature, and we saw the children playing outside in the rivers and down by the sea instead of just looking into this computer. So we have seen people enjoying outdoor life much more during this COVID-19 than we usually do.
I think that's a very valid point. In Barbados, similarly, when the first lockdown, well, the lockdown after it had subsided for a bit, and persons were very excited to go to the beaches, but you also saw that it increased persons' mindset. They were able to relax, and that also helps in terms of coping. Because COVID-19 hasn't only affected persons' health specifically, but also the mental health of the country. And that's something that we really have to take on board. So I completely agree with all of what you've just said. There has to be that balance, really. Get out there, still respecting the protocols and the social distancing, of course, but it's definitely needed.
Well, we've had Tasmania relies and has relied quite heavily on tourism, as you also said, Chad, in your country. And but the government supported and promoted a travel at home option. And there's a lot of people in the south of the state who'd never been to the north and northwest. You know, it might seem odd, it's not that big an island, but that's the actual reality. And so the government just recently also put out some vouchers, like you could use a voucher toward an experience or to accommodation. So that's helped stimulate our tourism through the winter. And so a lot of our tourism operators have had the best winter ever. I don't know how it'll hold up over summer, but we still haven't opened the borders yet to the mainlanders. So that hopefully will happen in December, but we'll have to wait and see what happens in Victoria.
For one, I just want to throw in a wee anecdote there about travelling your own area. I went to Stornoway one time, and there's a man beside me from Battersea, a small island beside me, and I asked him when he was last in Stornoway. And he told me this was his first time ever in Stornoway. But I knew he'd been around the world several times, and he'd been to Pitcairn Island in the Pacific 13 times, but never been to the north end of the Hebrides. So I can understand that Tasmania story. I'm sure it's the same in many other island groups.
Yeah. That is unique to have been to Pitcairn so many times.
13, yeah, it was a merchant seaman, yeah.
Yeah. Just one more question for you, Chad, which is from Sasha Mercer. Can you please give an update on your efforts to access financing options as a Caribbean island, especially now during the COVID-19 crisis?
Well, I can tell you one of the things that the country is doing is one, looking to retool its own domestic structure economically. But externally, we're also going in the direction of partnerships with other countries and other organizations to build that capacity. But one of the things that I can also tell you is that at the core of the recovery is small business and enterprise. That will drive the financing options for the country through obviously the recouping of taxes and the movement as well. Institutions like the International Trade Center here in Geneva, therefore, play a very critical role in helping countries to build out their domestic capacities for their small businesses sector. One thing that persons must be aware of, yes, government has a role in terms of providing stimulus in such an environment, but the level of ingenuity from our young people in business will play a very critical role in the restructuring of our economy moving forward. So that balance, again, has to be struck. So yes, government is pursuing options, but it has to be to create an environment for the private sector to fill that void, and you work hand in hand.
Excellent. Thank you, Ambassador. And I guess a final question before we wrap up, and I do apologise, we have got a few minutes over time, but it looks like the participant numbers are holding. And so I wanted to hear from each of you. We had a poll question, which is, do you feel optimistic about the future of your island or place? We've got most of the people have said that they're feeling, they agree, around about 40%, 30% are agreeing, and less so that are strongly agreeing there. So what are your perspectives? Do you feel optimistic about your place? Perhaps starting with Kristina.
Yes, I do feel optimistic about the Faroe Islands. We have a very strong economy. We have almost no unemployment. And I think that we have grown stronger out of this corona crisis. But of course, it depends on what happens in the long run. Hopefully a vaccine will be developed soon, so the world can go back to normal and we will be able to see all countries go back to normal. But the long-term effects could be quite serious if we don't find this vaccine. But I'm optimistic for the Faroe Islands, but I'm more worried when you think more international and on the global stage, because it can go both ways. I hope that the global leaders will come together and use this crisis for something good, to build back the stronger and more sustainable economies and to show solidarity. On the other hand, we also know it can go in the opposite direction, where countries lock down and protect the borders and so on. So it will depend quite much what the global leaders will do from now on.
And Angus, what's your...
Yeah, I'm very optimistic. I mean, I suppose I see, and maybe I'll start on a down note, but in the 20th century, our population halved, but by contrast, the Faroese population has doubled, if not trebled in that period. And with the greatest respect to Kristina, they're beautiful islands, but they're further north. So if you want to live further north with the great level of success that they've got, you might want to live a little bit further south and enjoy almost similar success. That's why I look at the Faroes and try to learn so much from the Faroes, and the success they're making of things up there makes me optimistic. And one of the things I raised in my earlier remarks, about the concern of young people in housing and the problems that COVID was creating, shows that people want to come and live here anyway. And we've just got to create ways that they might want to live here. And in the chat bar, I've thrown in some words that people might want to look at: Barra Airport, North US Gin, Isle of Harris beaches, so that people can Google in their own time. And you don't have to take my word for it. You can get the great Google out there showing you why you might want to live there. But you might also want to live in places like the Faroe Islands with their undersea tunnels connecting all their islands, the best 4G connections speeds in the world, fibre to every home. And they've done a lot socially as well. There's a lot to be learned from different islands and how we can make your places better. But yeah, certainly I can work now here with a greater broadband speed on the west side of a small island, the Outer Hebrides, than I can at Westminster, which was once the imperial capital of an empire that's thankfully gone.
Thank you very much. And Ambassador Blackman, are you feeling optimistic about Barbados?
Yes, thank you very much. Of course I am, and I'm not just saying that. Given what we've been able to do within the last couple of months in the COVID and through COVID reality, I think there's huge cause for optimism. As I said, we've now opened a new program where persons from around the world can move to Barbados for 1 year, go and come, and operating from there. But the optimism isn't only because of that. I think there's also a shared sense of global optimism. And given the fact that we're all interlinked as nations, we can build stronger. And I think once we pool our resources, our intellects together as countries, the world can be a lot stronger. It can be more sufficient in also areas that we've never looked at before. This crisis has really presented a lot of opportunities. The world is pregnant with opportunities. And I would just welcome all of you to relook the global economy whilst doing so in Barbados.
Fabulous. Ruth.
Yes, thanks, Jess. I am optimistic about Tasmania. We do have some challenges, but I think all states and small islands do have their own challenges. But I agree with Chad, we actually need to support innovation, we need to support small business, encourage people to shop locally and actually produce whatever we can within our own shores. And I think we've probably not realised how much we can do that. And COVID's actually been a real eye-opener for people to actually realise what they can buy and what they can make locally. And that's been a real positive. So there are swings and roundabouts in all of this. I think there's some positive things that have come out of COVID, but we do need to remain united and stand and work together to achieve the ends that I can be optimistic about.
Wonderful. Thank you so much. And thank you to all of our speakers and our audience for joining us this evening. We will be wrapping up. What I really heard is that, Ambassador Blackman started with really reminding us that it's been such a leveler and that we're all vulnerable in some way. We've also seen this really positive disruption from technology that's helping us to connect island to island, and other positive influences from looking at how to increase enterprise with young people. We've really seen that there's unexpected issues, such as some of the islands being perceived as a safe place. And so that may have also impacts in terms of how we think about increasing population on the sustainability of our islands, as well as the environmental impacts of PPE. What we've certainly heard is that some strong testing, early lockdowns and border controls are really vital, and fantastic to hear about the responses, really looking at building trust in the community, strong collaboration between islands and neighbours, and that we really can use our island advantage to turn out to be speedboats rather than super tankers. So we are absolutely needing these local solutions to our global challenges and building back better to achieve our global sustainable development goals. So thank you all very much, and may you have wonderful days and evenings, and good night.
Bye. Thank you.
Great to talk to you.
Bye.
Bye-bye. Thank you very much. Nice to meet you all.
Thank you so much.
You too.
Great day.